I'll stop, and Dr. McDonald and I will take any questions.
Dr. Alexander-Scott, I've heard from some dentists who wondered why they were down on the team. I know everybody wants to get the vaccine. You can't have everybody up top. But given what they were exposed to, and they're in effect bathing in saliva all day long, I just heard from someone who said, what was the health department's rationale on not having them higher on the list?
Yeah, and dentists, along with the other outpatient providers, are a priority group for us. With huge credit to the dental community, with the PPE that they started with and have maintained, we have not seen a significant amount of transmission at all within our dental community, and we give them kudos and appreciate that. We know that we have them top on the list as soon as we get the vaccine supply, but we're encouraged with knowing that they have been doing what they need to protect themselves until we can get there.
Thank you. Doctor, you said you're getting out all of the supply that you have right now. But the federal government has said that they expect to increase supply. They're going to release some of the doses that have been held back, and production should increase. Do you have all of the staff and the process in place to use all of the vaccine if that supply increases dramatically in the very near future?
Yes, we would welcome that opportunity. Our partnerships with key stakeholders in the state, we have continued to engage with in preparation. We will trust that the federal government, if they increase what they send us, makes sure that the second dose supply is available to send to us as well. But we are ready to go. Our systems are in place, and we are agile and will make adjustments as we have been doing to ensure that the 90% of the vaccine that we control gets out and into the individuals that we need them to receive.
The vaccine has been thrown out by your partners because they were not able to use it in time.
Not at all. We are completely on top of any additional vaccine that is available and immediately making sure that the next group in line has access to them. We are vigilant about ensuring that no vaccine is wasted.
You know for a fact that no doses in Rhode Island have not been administered, that have been thrown out?
We know that there have been no large groups, the way you're hearing in other states, of vaccine that has to get thrown out. We are monitoring the groups that are distributed to ensure that they are actually getting administered.
But small amounts might have.
That may be a normal part of the process, negligible, and it may be that that hasn't been the case. I just cannot tell you definitively myself. I can say that we have the process in place to ensure that no large volumes of vaccines are being wasted the way they're unfortunately hearing in other jurisdictions.
Doctor, can you share with the state why the governor wouldn't take questions today?
Josh and others are available to continue to answer any questions connected to the governor. We wanted to keep this focused on COVID.
Doctor?
Can you touch on the fact that Pawtucket last night voted grades 1 through 12 that they're going to have the children do distance learning, and they keep claiming that it's just not safe for the children in the Pawtucket schools. Can you touch on that? And should the teachers in Pawtucket perhaps get the vaccine too? It seems like a long time till the end of June that these children will not be in school.
Yeah, it's an unfortunate interpretation. We definitely understand the fears and concerns. We have shared again and again the layers of effort that have gone in to help reassure the teacher and school community of the safety of going to school in person, particularly for our younger students. We have the state-of-the-art Education Operations Center, only one in the country, most likely. We have a state-of-the-art K-12 testing system that allows for both rapid antigen and PCR testing available the same day for people who have symptoms. And now, for an additional layer, we are adding asymptomatic testing to be made available for students and the school community. And we have the data that shows we have not had significant transmission and outbreaks leading to multiple generations of cases within the school community. That structured environment really helps to minimize the setting. So all of those mitigation steps in place are enough for us to confidently say to Pawtucket and the other school communities that have understood this, that it is acceptable to bring particularly your youngest students back, knowing the challenges that occur for students who are missing that emotional, nutritional, educational exposure in person. The vaccine process, particularly as we get more supply, we're able to, because the mitigation steps that are in place in the education system are strong, we're able to focus the vaccine in its limited supply right now on the individuals who are at highest risk of hospitalization and ultimately death. That is not the case in our school community. As we get more vaccine, we have teachers and the school community in phase 2 as a priority group that we will be looking to move towards along with others.
Doctor, as a senior administration official here, I guess you're going to have to bear the brunt of the questions going forward about business openings. While all this is heartening to hear about the intense administrative effort to move forward with vaccinations, combine the fact that there's a potential that we will not have a governor answering to us for the next few months, and the continued collapse of the Rhode Island economy. So at what point in time will someone in the senior level like yourself address the fact that as we speak right now, businesses literally across the street are failing around us?
Yes.
There's a complete, what we've just been demonstrating here is a complete vacuum in leadership.
No, we have been addressing that directly. Each time we've come together and really following up in terms of execution and implementation. When the federal funding had run out previously for being able to support businesses, we were one of the few states that had additional funding because of strong management available to be able to offer to businesses.
Is that true, though? Didn't you largely just hold on to money that was supposed to have been distributed to businesses months ago, and then almost like a sop thrown to them as a dying last gasp at the end of December? I mean, again, what are we doing now going forward to open up businesses so that people can earn a living, feed their families, and not fall into continued bankruptcies?
And so, yes, what I said was true in terms of our ability to balance what the federal government has offered to support businesses. When that ran out, we were one of the few states that brought in the funding that we had managed well to make it available to businesses. And now, because of what's been passed recently, there's additional funding available to businesses. We recognize that it is not easy. This has been the most challenging crisis for any of us of this time frame, and we know how important the economic health of our society is as a part of what public health is. And so we want to continue to balance what the federal government offers, be supportive to businesses, and be, as a proud Rhode Islander, supportive of knowing that there's going to be even stronger policies in place on the commerce side at the federal level as we go forward.
Doctor, in regards to vaccine rejection rates, are you seeing a lot of that in nursing homes and various places that are now getting vaccine doses?
As of now, 56 of our 84 nursing homes have been visited for vaccination at least one time. We will be doing, the partnership will be engaging in 3 full visits to each nursing home to allow for increased uptake of both the first and the second vaccine. After that process is complete, we'll be able to share a full picture of what we have in terms of the overall uptake. In the meanwhile, we are encouraging every nursing home resident, every nursing home staff to please take advantage each of those 3 visits of getting vaccinated. This was our group that we needed to ensure is able to be protected from hospitalizations and ultimately deaths.
Secondly, forgive me if this was already touched on, CDC expanded the vaccination guidelines to everyone over 65, Rhode Island 75. Any plans to change that?
As soon as we get additional vaccine supply, we are ready to expand. We would welcome being able to extend it to 65 and older. And as I shared, that's 190,000 Rhode Islanders. So just getting 14,000 a week is going to be challenging for us to just do that tomorrow. And so once we get more to the state, we'll be able to move into what we all definitely want to be able to do.
Doctor, I just want to clarify on the numbers as well. Thank you for breaking those down, the numbers of vaccines and doses, but I just want to see where these are kind of adding up. How many of that 38,000 that have seen at least a first dose already, are the nursing home residents counted in that number?
Yes, through the partnership.
Okay, so if we're seeing then, 16,700 of those doses going directly to the pharmacies, and then 50,000, like you said, having been distributed to be ready to administer. It doesn't seem like it's adding up. It seems like there's a greater number than just the 14,000 that's being coming in to keep on reserve. Do those numbers add up? Can you kind of explain that?
We can certainly talk more offline, but I think the heart of what you're demonstrating is that it seems like we're getting even fewer than what we're able to actually get out and administer, and that's really a reflection of the fact that as soon as we get what we receive, it's added to our pool, we are doing everything we can to get it pushed out.